Hello and Assalamualaikum. My name is Sharifah Dania Binti Syed Ahmad Rizal, and I will be presenting about stroke, also known as cerebral vascular accident. What is a stroke? A stroke is an interruption in the flow of blood cells in the brain. So when the cells in the brain doesn't receive enough oxygen, they will die. There are three types of strokes. The first one is ischemic stroke, which occurs when blood vessels that supply the blood to the brain is blocked. The next one is hemorrhagic stroke. It is a bleeding in the brain that occurs when weakened blood vessels ruptures. This is caused by aneurysms, arteriovenous malformations, AVMs, and the most common cause of hemorrhagic stroke is uncontrolled high blood pressure. Lastly, it is the transient ischemic attack, TIA, also known as a mini stroke, which is caused by a serious temporary clot. TIA is a warning sign of stroke and should be taken seriously. Moving on to precautions, how can we avoid having a stroke? We can avoid it by quitting smoking. Daily cigarette smoking increases the risk of stroke by 2 times. Then, managing blood pressure and cholesterol levels, meaning that have a regular medical checkups, work with your doctor to control your high blood pressure, and this is especially important if you have diabetes. After that, getting regular exercises. Physical activity can help you stay at a healthy weight and lower your cholesterol levels. To maintain your healthy weight, you have to make sure that your weight is in a healthy BMI range, which is 18.5 to 24.9. For health educations, how to detect when someone is having a stroke, just use the acronym BFAST. B is for balance. Is the person suddenly having trouble with balance? E is for eyes. Is the person experiencing blurry visions? F is for face. Ask the person to smile. Does one side of the face droop? A is for arm weakness. Ask the person to raise both arms. Does one arm drift downwards? S is for speech difficulty. Is the person's speech slurred and hard to understand? And T is for time. If the person shows any of these symptoms, call the ambulance right away. Do not drive to the hospital or let someone else drive you. Call an ambulance so that the medical personnel can begin life-saving treatment on the way to the emergency room. During a stroke, every minute counts. Lastly, I have included an additional information on the prevalence of stroke. The rate of stroke that have occurred in Malaysia is estimated to be more than 40,000 cases per year, and 10.7% of stroke patients died. That is all from me. Thank you very much for listening.